I know I've been MIA, but let's just take a second and admire this little baby bump that just popped up in the last few weeks. So obsessed. But we are past the second trimester. We made it. What's up guys, my name is Eleonora. I know it's been a while since I have updated on my pregnancy. I have been in my second trimester. Hopefully I get this video out as soon as possible because I've been so slow to getting things done. Just been in my own little bubble this pregnancy, just kind of bobbing along and just going with whatever comes my way and really trying to enjoy every little experience that comes with this because it is so magical. I feel like the second trimester kind of ends up being the longest or feels like the longest because you know, your first trimester, you don't even know that you're pregnant the first 2 weeks. And then depending on your preferences, you know, when you actually start to share that news, kind of flies by in a different way. And then third trimester, you're already waiting for baby to come, you know, nesting is going to start. I mean, nesting has already started, but you know, you start to really prepare for your actual birth and for a baby to actually be here. So let's start with the obvious. Weight gain, right? Pregnancy, you gain weight, you get bigger in ways that I obviously have not expected. I sometimes go through my old photos, especially from the beginning of pregnancy when I just found out and I was taking pictures already. It's amazing the way the psyche works that I thought I was big at that time and I thought I could stand to lose a few pounds. Not that this weight gain is just weight gain. Obviously there's a reason for it, there's a purpose, but it's quite the mind game there. Probably every single app told me between weeks 23 and 27 is when baby doubles in size. And I can definitely attest to that. I noticed it in myself. I noticed it in my bump. 100% believe that baby doubles in size between weeks 23 and 27. And with that rapid growth, not only in baby, but in myself, came slightly kind of an identity crisis. I began to not recognize myself in the mirror, which really surprised me. I didn't expect to have an emotional reaction to my physical changes because I know what it's for, right? I'm not just gaining weight just because I am putting on weight because of a baby growing inside of me. So around week 25, I went to try on bathing suits because it is hot in Florida and none of my suits fit. And I just tried on the worst possible swimsuit for my body, even pre-pregnancy. And that upset me more than I expected. And I had a good cry, but ever since then I truly am embracing the changes now and I really feel more feminine because of it. I cry randomly, I cry a lot. I'm a pretty emotional person, so letting that out, I think it was just something was bottling up there that I needed to release because thankfully after that I felt so much more connected and in love with my growing body because of why it's growing, I guess. If we back up to week 16, I had an appointment with my midwife and she had suggested to start preventative care, you know, acupuncture, to start getting chiropractic adjustments just to accommodate my growing body. And I remember at the time I was like, I'll be fine. I'm active, I'm eating well, everything's good. My body will just adjust by itself. But about 2 weeks later is when the hormone relaxin kicked in. And that's really when your body starts to move and adjust. And I got such bad pelvic pain. I couldn't walk for a day or two. It hurt so bad. And I was like, okay, maybe I do need to see a chiropractor. And thankfully there's an amazing prenatal chiropractor near me that I've been going to since. So I've actually never had been to a chiropractor before in general, so this was kind of nerve-wracking to me to go to a chiropractor for the first time while pregnant. So during the consultation, you know, we have a consultation when we talk, and then there's kind of a scan. It's not x-ray scans or anything like that, but just to see where my body's at. And I was super surprised to see the results of that. I never knew the impact that your spine can have on your entire well-being. Your spine is essentially a reflection of your nervous system, which is things that I didn't really pay attention to before. I never knew that. So this is what a normal balanced nervous system is supposed to look like on these tests. Everything is balanced in white. and this was my test. I knew that my nervous system was unbalanced, but I didn't realize that it was to that extent. I guess I did expect to see not the best results because of knowing that I am in a constant fight or flight. It's not news to me. I know that sometimes my heart rate can race from just sitting down and not much is going on for me to have that fight or flight response. So since seeing a chiropractor, I started seeing him twice a week at first for the first couple of weeks, and now I am seeing him once a week, and I'm sure that will change as I get closer to delivery. But it was really nice to find someone that is really making a difference in how I'm feeling. And my fitness routine has changed dramatically. Listen, all of you women who work out pretty much the same as you did pre-pregnancy, you are my heroes. I am not working out how I used to. I am totally okay with it. I was very into heavy lifting and kind of pushing PRs and pushing weight. I still try to get to the gym for weightlifting a couple times a week. It really depends on how I'm feeling. Like I said, I just can't plan my energy levels, and I don't want to put that pressure on myself. I am trying to be in tune with my body, and if things hurt in a bad way, I'm not gonna push it. Don't have anything to prove to anyone. I just am focusing on some movement. I do feel better after I work out, so that is important for me to keep up with, but it's nowhere near how I used to. You know, if I can't get to the gym, I at least try to make sure I go for a walk. I try to walk every single day, at least to some capacity, because you just can't be sitting all day. If I sit for more than 30 minutes at a time without getting up, that's it. My body hurts in the worst way. I gotta adjust, I gotta stretch, and I don't wanna say it's only getting worse, but my belly is growing, so other things are going to start hurting. You know, I've upped my glute training recently because my belly's getting heavier and it's kind of pulling my weight forward. And then recently I've started to make sure to stretch every evening when we're watching TV and kind of winding down. That really helps. My body is getting so tight in ways that I can't even keep up with. Speaking of growth, my baby bump, my innie is now an outie. I'm kind of worried for it to pop out. I think there's one part of it that's already popping out, and I hope that's normal. But my belly is definitely stretching. My belly button, I feel like, is a little pigmented, either around or inside, like some kind of pigmentation. I don't know, that's just from skin stretching. I do have the linea nigra that I wasn't expecting to get, because a lot of apps and things said that you get it earlier than what I actually did, so I thought that I wouldn't get it, but it's definitely there. But my belly button has also been getting, if I don't use some sort of body butter or something on my belly, it gets really dry around it. I have gotten to a point where I have to put the belly butter on twice a day because once at night is just not enough. The skin is stretching so quickly. I am prone to stretch marks. I already have stretch marks like on the sides of my thighs and the inner thighs, just from gaining and losing weight all my life. So is this actually going to help prevent stretch marks on my belly? I have no idea, but it feels nice and it's working. It's at least keeping the skin nice and nourished and not so dry. I was using whatever I was using on my face, that skincare line, but because it's my belly and it's kind of like directly towards my baby, I didn't want anything with too many ingredients. I just wanted something simple, and I used the Earthley whipped body butter. I think there's like 3 ingredients in it, and that just makes me feel more comfortable because just so close to home. Okay, and at 20 weeks was the beautiful anatomy scan that we got to do, and we got to see all of baby, and we already knew the gender like at 11 or 12 weeks. We did the test. It's in the first trimester video, but I didn't want to tell people what the gender was until we confirmed it at the anatomy scan, even though that test is super accurate. Just wanted to see for myself. So you already saw my original reaction in the first trimester video, you know, when we just opened the email and found out what we're having, but then I also filmed something for Instagram to kind of announce what we're having. So here it is. On 3.
Yeah. One.
On 3 we're twisting.
Yes.
Should be 1 twist.
I hope so. I don't know how many twists I never did. No, 1.
Point it up, not okay. 1,
2,
2, 3.
Oh,
It's a girl!
hey.
We are having a baby girl. We're having a baby girl and we're both ecstatic. We really wanted a girl. In that video, of course, my Canon decided not to go off. And thankfully I already knew the gender because I would have been pissed if I didn't know when that happened. We ordered 2 Canons from Etsy and it's like, you have one job just to have the Canons, you know, to work. Obviously I reached out and they refunded it, but man, if I didn't know the gender and that happened. But whatever, it doesn't matter. We're having a girl. Anatomy scan, we got to see all of her. We started obviously with the profile, so we saw her cute little button nose and just her pouty little lips. And then out of nowhere, our ultrasound tech shows us a 3D image of her. 3D image of her where we saw her face, like we saw her features, and we saw her. I still can't wrap my head around that. You see a face in ultrasound, but I still can't picture what she's gonna look like when she comes out. It's wild. It's trippy that, there's a little face and a baby vagina growing in there. But now I can finally refer to her as baby girl. She's super active some days and just chilling the others. And it's just so magical to feel. I think around 19 weeks was when my husband was able to feel her as well. I'm pretty sure I started feeling flutters at like 13 or 14 weeks, something like that. But to have him finally be able to feel her was really cool. It's actually gotten to a point now around 28 weeks that he can hear her heartbeat if he puts his ear close enough and we're all steady. He can hear her actual heartbeat without any apparatus, like no Dopplers or anything like that. So that's been really cool. And then super recently, she started having hiccups. I read about it. I have like pregnancy countdowns and stuff saying that it's possible for babies to start hiccuping. And I didn't think that I was gonna feel something like that until I did. It's like this very rhythmic, like your belly just kind of spreads. It's so cute. But it's just overall such a miracle to feel her growing. All right, guys, the glucose test. This test caused way too much drama for no reason. I was gonna make a whole separate video on the glucose test, but I just decided to make it short and sweet as possible, and just in this little update. I decided to decline the glucose test, and I'll explain a little bit of why. First, my legs are falling asleep. Oh my gosh. Can't sit for long periods of time anymore. Okay, so what is the glucose test? It tests for gestational diabetes. Gestational diabetes is high blood sugar during pregnancy. Some of the risk factors include being overweight or obese, not being physically active, having family members that have diabetes. And honestly, in a lot of countries, they don't even test for gestational diabetes unless you have a BMI of 30 or higher. How is the test performed? Traditional medical settings, you have the glucola drink, which is 50 grams of glucose. Midwives or more holistic practitioners have other options aside from the glucola drink. Not the best ingredients in that. You can do something like grape juice or the fresh test, which is the options that I was given. First, you just go through a screening. You have a normal breakfast, drink the drink in 5 to 10 minutes, and exactly an hour later, you take the blood draw to see if your sugar is over 140 or not. So what happens if you test positive? There's additional screenings. I don't think they diagnose you with gestational diabetes right away. I think there's a 3-hour fasting, something like that. To be honest, I didn't look that far into it because I did not even do the 1-hour screening. So if you look anywhere, the treatment plan for testing positive for gestational diabetes is you have a meal plan that you have to stick to. You have to monitor your blood sugar levels after every meal. If it's really bad, then you might even need to take medication, some kind of insulin. So what are the risks of testing positive for gestational diabetes? The main one is your baby might be too big, like big baby syndrome, or your baby has a risk of having shoulder dystocia. Now let's talk about big baby syndrome. There's no actual way to know how big your baby is going to be born until your baby is actually born. I have seen countless stories of women being, oh my God, my baby was only this amount of pounds. Like I was expecting him or her to be so much bigger because of the scan or this or that. They make you think that your body is growing a child or a creature that is bigger than your body can handle. And like I mentioned, there are risks where that might be possible, but I just did not think that I fell into any of that. I just don't want medical professionals putting it into my head and making me believe that my body is growing a baby that's too big for me to give birth naturally. And to be honest, I am confident in my decision of declining the test, but let's be real, this is my first baby, so do I have doubts about every single decision I make? A little bit, because you don't know what you don't know. But I made it a point for me in this pregnancy to not put any power of validation through external sources. I want to be in tune with my body and trust my intuition because I'm going to be a mother. Their mother's intuition is a thing. and I don't want to be convinced or pulled in directions where I'm made to believe that that's not a thing. So of course, some of the comments that are made, you know, they do get to my head, but it is my duty to work through that, push past that, and really give myself that power to know that what I'm doing is right for me, my body, and my baby. That's it. So why did I decline this glucose test? I researched what the actual diet for gestational diabetes is, and I can confidently say that my diet is superior to that. I eat lots of animal foods, lots of fat soluble vitamins are in there. I exercise regularly, I'm physically active, and honestly, I naturally don't gravitate towards a lot of carbs. I get pretty full from what I eat, and I don't have that urge and craving for a lot of carbs. So, you know, I have minimal cravings, and the cravings that I do succumb to just keep me sane and happy. Even for myself, just not necessarily because I don't want to gain weight, I watch what I eat because I don't want to make it harder on myself during labor and delivery. Second reason I declined is I don't want anyone telling me or putting into my head that I am possibly going to have a big baby, and then eventually they are going to want to convince me to get induced or have a C-section because my baby's too big. I don't want those kinds of comments. I don't want to hear things like that. I don't even want to give anyone the opportunity to say that to me. Don't get me wrong, I love the practice that I'm with. My midwife is awesome, but I just don't want to give anyone that option. Third reason, I don't have any underlying issues that would cause me to have gestational diabetes. I know that it's not only about what you eat, because it has something to do with how the placenta is processing insulin, something is blocking, something with hormones. I get that there's placental involvement, and it is possible to test positive for gestational diabetes, even if you're lean and active and all that. The one thing that doesn't make sense to me is how you can test positive, but then have a treatment plan of eating differently. That's one question I never understood. So I did have a different midwife that appointment that I was supposed to get the glucose test. She wasn't too thrilled about me wanting to decline the glucose test, but at the end of the appointment, I had breakfast, my usual breakfast, about an hour or two before we were meeting, and did a finger prick to check my glucose, and that was enough. Whatever, everyone's happy, that's fine. I just didn't want to do the whole drink and all that. It's such a short glimpse into something. I would never drink 50 grams of glucose in one sitting either, so none of it made sense. That's why I declined. Not saying you should, but that was my decision, and I am standing by it. Okay, some weird symptoms that popped out over the course of the second trimester. Around week 25, for about a week or so, I started to get the taste of iron in my mouth. So iron and blood. I thought I was bleeding in my mouth. And for a few days, maybe more, I didn't have bloody noses, but if I would blow my nose, it would have like bloody boogers in it. And that lasted for at least a couple of days, if not a week. So I don't know if my body was just producing a lot of red blood cells, because ever since then, I get hot so easily. I feel like I have extra blood, if that makes sense. But my blood flow definitely increased, and it gets very hot very easily. I have a weird desire for mint. Every time I brush my teeth, specifically at night, I want to like eat the toothpaste. I don't, obviously, but I want to. I use Tom's of Maine, like the fluoride-free one. I'm sure this can be subsided, like this craving, with gum, but I haven't chewed gum in years because it used to hurt my stomach, and I'm having like jaw issues, so I don't really want to be chewing gum. But yeah, mint. Really want to eat mint. Lightning crotch. I've heard about this, and I thought I had it before, but at 27 weeks, I was in Costco, and all of a sudden I really had lightning crotch. Like that hurt. I don't know what causes that, but that was definitely it, not what I had before. Definitely feel a lot of heaviness in my pelvis. When I feel like she has a growth spurt of some kind, it just feels heavy, like really heavy. Adjustments have been helping with that. Also, in the second trimester, I still threw up a few times. As close as 25 weeks was the last time, I think. There's no rhyme or reason. I wouldn't say that it's from a specific food. It was just random. Nausea comes and goes still, but yeah, I still had times of vomiting, so apparently that's not a first trimester only thing. So some goals that I had during the second trimester that I really wanted to finish was have my registry done in the second trimester, and thankfully I did that. I do have a video of that coming, I promise. There's just things that I kept changing and removing and putting back as recent as last week. So I think I'm done. I think it's officially, I don't think I want to touch it anymore. Our baby shower is set for mid-May. People have already started to send us gifts from the registry to our home. If only you saw what the back of this camera looks like, just boxes of stuff already that we're gonna have to make room for. But I'm excited for our baby shower. We weren't planning on having one actually, and then kind of just decided this baby needs to be celebrated. This journey needs to be celebrated, and you know, I want to do it. I want to do it. Let's do it. So that's set for May. Keeping it super simple. I'm reading lots and lots of books. I ordered way too many books. I'm not gonna finish all of them before baby comes. There's no way. I have pregnancy books, birthing books, and I even got some books on like child development. I started reading Montessori books that I got, and it was helpful because that kind of helped me gear or help guide me for what I wanted to put on my registry. But now I just don't have the capacity to think about child development. I'm still pregnant. I still have to give birth. And I'm just focusing on the books that cater to that right now. My favorite pregnancy books are the Mama Natural one and Nourishing Traditions for baby care and pregnancy. Those have been my go-tos that I'm consistently reading. I'm also reading Ina May's book on childbirth, and I have a book on hypnobirthing. I think I will also purchase Ina May's book on breastfeeding just to have that on hand. I do love the childbirth book. I think it's very educational. It has a lot of good information there. But other than that, my mind is like, I think in the 3rd trimester is really when the brain development of baby happens, like the finishing touches, let's say. And I feel it. My brain just is not functioning as well as it did before. I can only grab on to so much more information now. I'm kind of really slowing down with that just because there's just so much, and I kind of have to prioritize like what's important for right now, and right now it's pregnancy and childbirth. So I mean, talk about journey to motherhood. You know, I'm obviously changing physically, but I'm also changing emotionally, spiritually, mentally. Like I feel my brain changing. I no longer look at things the way that I did before. There's just so much happening consciously and subconsciously because it's just your body doing it for you. It's just so wild to think that in a few short months, life will never be the same in the best possible way. But this whole identity shift of becoming a mother and this whole pregnancy experience, like sometimes I look in the mirror and I just don't recognize myself, not necessarily in a bad way, but I look at my face and my face looks different. I know it doesn't, or not extremely, not dramatically, but I feel like I look different. It's kind of trippy sometimes, but I just feel an immense amount of gratitude to be able to experience this and share this. We are in the home stretch of meeting baby girl. Thank you so much for watching. If you haven't yet, please make sure you subscribe so you don't miss any future videos. I will try to share a little bit more as much as possible now that we're in the home stretch. We're almost there. I have a lot of things that I've been preparing, and I would love to share that here. So thank you.